So we will be discussing natural disasters and their health implications of India and Haiti. Our group constitutes of me, Lucas Stoiter, Riley Cleaver, Caden Rose, and Colin Wokevich. So a little introduction about these two countries and natural disasters. A natural disaster is a sudden and powerful event in nature that often, sorry about that, that often results in serious damage and or death. Um, this varies across climates and countries. Depending on the climate, a natural disaster could look from anything from a tornado to a hurricane to even an earthquake or even a volcanic eruption. India and Haiti are especially prone to these natural disasters. And some examples that they typically experience include hurricanes, cyclones, earthquakes, floods, and then there's a couple more. They have some pretty similar natural disasters just due to their climates being fairly similar and both of them being placed near a tectonic plate. Um, so starting with India, India has a population of 1.3 billion people as of 2018, and this is one of the on the greater side of a large country population in the world. India's geography is bordered by the Arabian Sea and the Bay of Bengal, and so this is what makes it especially vulnerable to any sort of natural disaster that is due to ocean weather or water, such as a tsunami, a hurricane, or monsoon, stuff like that. India is made of 28 states and has 8 union territories. There are many different ethnic groups that are included, and many different languages are spoken. As said earlier, India sits on a tectonic plate, specifically the Indian tectonic plate. And this tectonic plate is actually responsible for the Himalayan mountain region that results on the northern border of India. Logistics about India. So it's the seventh largest country in the world by land area and the second largest by its population size. The major religion is Hinduism, with some minor religions including Islam, Christianity, Sikh, and then a few other unspecified just because of the large culture of people that are present. English is the official language spoken there, but there are many others, such as Hindi, and it is a developing open market economy. So, bouncing off that last point of India being a developing country, its healthcare system is partially then affected by this, in that it suffers from poor management and funding. Only 25% of the population has access to Western medicine, which really inhibits people from accessing the proper health care they need and helping India's population to flourish. Some traditional indigenous medicine is commonly practiced, which makes up for the lack of Western medicine that is present in the country. And then a third of all neonatal deaths are contributed to India. So this is just a statement of the status of their healthcare. Um, and then also another thing with their healthcare being part of a developing country is that there's an uneven distribution of care and inadequate infrastructure limits India's healthcare capabilities. So all these things make India especially vulnerable to natural disasters. The geographic landscape causes the disasters, then India's functionality as a country affects its response to the disaster. 27 of the 36 Indian territories are categorized as disaster prone, according to an article made in 2024 titled Disasters in India, that just goes over the types, causes, impacts, and measures of them. 22% of the population is malnourished, with 44% of children being part of that, which is extremely debilitating when considering natural disasters and how they affect the country and how the citizens are able to respond, that they must face with a lack of food and a lack of or destruction of their property, some places to stay and all that. And then as a developing country, a lack of infrastructure within India makes it especially vulnerable to natural disasters. So that's just a summary of everything that India has going for it. I'll hand it off to Colin now.
Yeah, so now we're going to start looking at natural disasters of India. We'll start off with earthquakes. The tectonic features such as the Himalayan rain or region, making India especially prone to the seismic activity. They sit pretty much right on the Euro-Asian tectonic plate, so it pretty much makes them uh, active with earthquakes and landslides because of the Himalayas as well. Besides earthquakes, like I said, there are landslides. And then floods. India's floods are often caused by monsoons, silted river systems, and erodible mountains. That would also translate with landslides and avalanches. Cyclones, rapid, strong air circulation, and tsunamis, large displacement of water due to changes within the ocean. Some natural disaster effects. India's developmental status increases natural disasters effects such as natural disasters lead to large loss of life and property. The term life includes human life along with agricultural and animal life. As prior, Lucas did mention that it's a developing country still in economically, and I mean this just doesn't absolutely help them at all. Great economic loss is often a result. Looking at from 2018 to 2022, there was some uninsured damages reaching 32 to 94 billion dollars or 32.94 billion dollars. Business interruptions are common during disasters. Mode of transportation, especially with landslides, uh, like their main way of travel is train and cars. So if those roadways and rails are blocked, obviously getting to work is pretty impossible. Natural disasters in India can lead to both physical and mental health determinants. Some physical health effects of natural disasters. Unintentional injuries are the top 10 leading cause of death in India. Natural disasters are always unintentional. So, looking at that in that kind of aspect, obviously, it will be part of the top 10 leading causes. The Kashmir flood of 2014, there were 277 deaths, but that doesn't compare to the 2004 Indian Ocean tsunami, which killed 227,000 people, uh, which that was, it appears to be, at least on this list, the uh, most deaths that India has experienced. And then in 1999, the Odisha cyclone, which killed 9,887, and the 2013 Uttarakhand flash floods, which killed 6,054 people. The mental health effects of natural disasters. Victims experience mental health complications directly associated with the event or following conditions. As you can imagine, anxiety, depression, and even PTSD followed these traumatic events. The 227,000 people, either that, and that's people killed. So people lost their family members, and even without the deaths, people did get displaced from homes. Homes were wrecked. So people finding new places to live in new areas that they need to get to so that they have some form of shelter. Um, just definitely messes with the mental health of everybody. Uh, Despair and excessive psychological distress were often common. Severe disaster case with the Indian Ocean tsunami 2004 was just grief, shock, and dysfunctionality were the most common mental disorders, as you can imagine. And then healthcare response. Nurses are pivotal for the rescue and relief phase after natural disasters. Nurses handle the first line of defense in a disaster situation, and this results in a large mental toll on the patients. And then healthcare professionals can result in depression and many anxiety disorders as a result, and many of them may quit their job as a result. Uh, I mean, looking at that overall, with every single disaster that we mentioned in the previous slides, the healthcare professionals do have to seem a lot on their they do seem to have a lot on their hands. So not only are they not getting maybe some of the time off that they need, but it's around the clock care with a lot of these people, and that affects not only the healthcare but also the care that the people end up getting. And as we did read even before, Lucas did mention that their healthcare isn't as great. So I'm gonna hand it off to Caden.
So then, looking at Haiti, here we just have a couple images of depicting the culture of Haiti, as well as the flag. So Haiti is located in the middle of Central America. It's just off the coast of the United States, and it borders on this next picture. It borders the Dominican Republic. It's the only land border that the country has. The next closest countries are Cuba as well as the Bahamas. But most of Haiti is coastal, but a lot of the population is sitting in the mountains. So a lot of the population is centralized around the capital, which is Port-au-Prince, or other coastal cities. This is good and bad for Haiti because they do have access to a lot of trade, being near North America, near the United States. However, the difficult landscape and geography of Haiti makes it a little more difficult to be highly economical, but we'll talk more about that later. Looking a little more at Haitian culture. Haiti means mountainous country, as I talked about earlier. I believe two-thirds of the country is mountainous country. So the border between, I'll go back up to this slide, the border between Haiti and the Dominican Republic, it is all separated by a mountain range. Haiti has grown from 431,000 to upwards of 7 million by 2000, and that number has only grown in recent times. Most of their history, they've spoken mainly French and Creole. That's because Haiti gained its independence from the French in 1804. It's also one of the poorest nations in the Western Hemisphere, which we'll talk about more as we dive into Haiti's economics. So then currently, like I talked about in the last slide, Haiti's population has blown up to 11.64 million people. Most of the population descended from enslaved African people after they won their independence from France. France brought the slaves, colonized Haiti, and then yes, they were actually the first completely African American free country. And like I talked about, it's very mountainous country, as in the name Haiti. Two-thirds of the country is above 1,600 feet. Looking at a couple other interesting logistics, 61% literacy rate in Haiti, which is the lowest in Central America, as well as there's lots of immigration out of the country. Lots of people are seeking better opportunities out of Haiti due to many of the challenges that they face that we're going to talk about more as well. So lots of people will immigrate to the Dominican Republic or Cuba that is nearby. Some will even try and make the trip to the United States, and that's a very deadly trip, not a high survival rate, but it just goes to show that there's lots of immigration out of the country, people pursuing better lives because of many difficulties that the Haitian people face. And like I talked about earlier on the last slide as well, there's a high population density, both in urban and rural populations. Because the country is so mountainous and not a lot of land mass, it is very centralized around big urban cities and then rural populations. There's not a lot of farmland, so wherever it is packed. So now I'm finally talking about the Haitian economy. It's the poorest country in Latin America and one of the poorest in the world. I believe it was second or third to last in the world, but dead last in Latin America. In 2023, the GDP per capita is 1,693. 36.6% of the population is projected to live on less than 215 per day. So what does that mean? It means there's not a lot of good access, to healthcare, to other economical resources and housing, which we're going to see the detriments of that, talking about these natural disasters that Haiti is very prone to. And then Haiti is also very vulnerable to gang violence, political unrest, and natural disasters, which we are going to talk about these next couple of slides. Looking at specifically at healthcare in Haiti, the life expectancy is 65.1 years, which is towards the bottom of Central America as well. Public health expenditure is 0.43% of the GDP and 3.92% of total public expenditure. This goes to show just the many difficulties that Haiti faces, and it's not getting any support from its government as far as healthcare goes. 0.43 is abysmal. There's only 38.9% of the population with internet access as well. So meaning that even these people who aren't getting invested in as far as healthcare, they don't have the possibility or the means to access healthcare online. The infant mortality rate is 59 deaths per 10,000 live births. The maternal mortality rate is 350.4 deaths per 100,000 live births. And the mortality rate is 115 per 1,000, which is also one of the highest in Latin America. And then talking more about that mortality rate, there's a couple big factors in it. Poor living conditions. Most people of Haiti do not have access to typical sanitation, typical even latrines, toilets, and we're going to talk about that more as well. But that kind of goes in the third point, structural problems of sanitation. There's not good access. And the fourth point, structural problems of drinking water. Most people in Haiti do not have access to reliable, clean, healthy drinking water. And that goes hand in hand with the second point as well, malnutrition. I talked a little bit about Haiti. Haiti, obviously, very mountainous country, not a lot of farmland available, so there is not a lot of opportunity for nutrition. So then looking at this graph over here, in 2019, this shows kind of percentages of that mortality rate. The blue, 24.7%, is communicable maternal, perinatal, and nutritional conditions. The big blue right here, which is a majority of the deaths, is non-communicable diseases, and we're going to talk about more of that as well, such as cholera is a big deal there. They had it taken care of, but just recently there's been another cholera outbreak, and then the last portion of that mortality rate is the injuries. Another huge detriment to the healthcare of Haiti is gang violence. So Haiti is actually currently, as we speak, experiencing a humanitarian crisis due to gang violence. From the July 1st to September 30th in 2023, Haiti reported 701 victims of abductions and 1,239 homicides. So not related to not directly related to the kidnapping, to the homicides. There's an estimated 1.4 physicians and 1.8 nurses per 10,000 people in the public sector. So what does that mean? That means there's not a lot of healthcare workers in Haiti. And so if you have these abductions, these homicides, if you lose even one physician, one nurse, that's 10,000 people that are at huge detriment, at huge risk. And then there's evidence that health workers are increasingly targets of violence, which we're going to talk about on this next slide. So, in a survey done by Belt et al. In Port-au-Prince, they gathered the total number was 272 respondents. So 98% of those respondents, 244, are concerned for their safety as health workers or medical or nursing students in Port-au-Prince, which is the capital of Haiti. 70%, 173 respondents and said medical professionals are at heightened risk of being kidnapped. 44%, 110 of those respondents reported that they had a colleague kidnapped in the previous 2 years. And then 74%, 184 of the health workers and students surveyed reported that they plan to continue their profession abroad. So this just goes to show that on top of the healthcare problems that Haiti already has, they're having a much larger crisis of losing the healthcare workers that they have there, and in the future, just not having even close. They don't have what they need now for healthcare workers. In the future, losing even more. So now that we've talked about healthcare in Haiti, we're going to talk about natural disaster risk factors. So just the geographical location, we kind of discussed this at the introduction, but it lies right on the fault line between the North America and Caribbean tectonic plates. It's highly susceptible to seismic activity. So that means earthquakes, but also tsunamis are a big deal coming from them. And some environmental factors, it lies near the equator. So also at risk of cyclones, hurricanes, tropical storms. The country is really in the perfect center to be at huge risk and huge vulnerability for natural disasters. So talking about some of the history of the natural disasters, Haiti has experienced natural disasters almost every year over the past 4 decades. Some of the big ones that we're going to talk about is the 2010 earthquake, which killed hundreds of thousands, displaced the same amount. Hurricane Matthew in 2016, and then a most recent earthquake in 2021. So Riley's going to take over and talk about some of the health effects of these natural disasters.
Yeah, I'll be breaking down some of these natural disasters like Kaden mentioned. So moving in. So that first earthquake in 2010, it was a 7.0 on the Richter scale. So one of the higher on the Richter scale for those earthquakes. It killed 230,000 people and injured more than 300,000. So that makes up like almost a tenth of the people in Haiti got injured by this earthquake. Infrastructure and homes at Port-au-Prince were destroyed. Thousands were displaced. We'll talk a little bit later about how one of the schools for nurses was also destroyed in this earthquake. And then the arrival of the United Nations brought the arrival of cholera to Haiti, which they hadn't been exposed to it yet. The acute waterborne disease that causes infection of the intestine. And so this was like one of the biggest cholera outbreaks ever. It resulted in 800,000 cases, 10,000 deaths. So even though they came to help them in the response to this earthquake, it ended up even killing more people than the earthquake did. And it was like a disaster all around before and after the earthquake. And then since 2010, cause become an epidemic. No cases recorded after 2019 until present 2022. They face another outbreak. So, and then talking about like the psychological health effects that this had, um, it was like they had many psychological and physical health effects. Then through like the adolescents and young adults, they grew up with this earthquake, and it's all they've ever really known. Um, Study of 723 adolescents 6 years after the events of 2010 said that between ages 14 and 24, they experienced earthquake in Port-au-Prince. 356 participants, so 49%, um, presented moderate PTSD symptoms. So after the earthquake, a lot of people resulted in PTSD, almost half of the participants. And then severe PTSD symptoms were in 35 percent of the participants, 44% male and 26%, 44% female and 26% male. And then 6 years after the earthquake, more than 62,000 people continue to live in 36 makeshift camps where access to basic services is still insufficient. And these PTSD symptoms are long lasting. Even after like 6 years, PTSD can be a lifetime problem that they have to deal with for the rest of their life. These people, when they were young, when they faced this traumatic event, they have got PTSD, and now their lives will never be the same. And then moving into Hurricane Matthew in 2016. So before the hurricane, they were still responding from the effects of the earthquake in 2010. So they were still with like a weakened government, very limited healthcare resources, because that earthquake destroyed and displaced so many people and so many, so like in that major city, which makes up a lot of their population. It was all pretty much destroyed. And then the limited rural availability because it was already people were moving out there to make their camps. And then the survey carried out in the rural community where there were locations of a skin disease outbreak. It had 433 participants. 67% of participants didn't have access to healthcare. 82% reported suffering from a health problem. 93% reported not having access to suitable shelter. And then 76% did not have access to a toilet or latrine. So after the earthquake and their weakened government limited healthcare, all of these compiled onto this hurricane, and then all these people were stuck without healthcare, without access to basic human decency. And you can see it through the deaths from the hurricane. And then four major categories of the skin infections that they had. They had parasitic infections, fungal infections, putrid infections, and then atopic dermatitis. And there were 28 diagnosed with other non-specific afflictions. And then some of the psychological effects of this hurricane, this resulted in mass destruction in many parts of Haiti, which increased their poverty even more, which results in more psychological problems people deal with, anxiety, depression, and PTSD from the hurricane as well. And then this slows economic growth. And then this mixed with the natural disasters to destroy infrastructure, and then there's still economic growth. It keeps people in poverty so they can't get back to how they were. And this trickles down, like I said, into depression, high suicide rates, lots of anxiety. But Haiti could prosper, but these natural disasters keep once again and again, keeping them impoverished in ways they can't develop. And then moving into the healthcare responses, the 2010 earthquake that hit, it destroyed an entire nursing school, like I said, in the capital, killing many of the students and faculty. And so with the earthquake, it destroyed a lot of the buildings in the capital of Haiti. And so there was no way for them to train the nurses or get like a proper education for them. So this results in more like less nurses to deal with the people. And then in turn in 2016 with the hurricane, then they don't have the amount of nurses they need to care for the people that are getting displaced or need help. So also Haiti doesn't have any like access to training for specialty care, so they can't deal with things like cancer or intensive care, and they result in more deaths because they can't care for these patients. And then since that hurricane from now, they've been working on trying to standardize the curriculum so they can improve their healthcare overall, and then cover those more complex issues like cancer and more things that need more intensive care so they can help overall to improve their population. And then Haiti and India compared. Both of the countries face similar issues, including limited healthcare accessibility. So they both have very limited healthcare that they can access. limited access to proper sanitation. So these countries, a lot of people are displaced. They don't have toilets. They don't have places where they can wash their hands properly. So it increases their chance of infection. The poor healthcare infrastructure, both of them have suffered massive earthquakes and destroyal of their infrastructure. And then this in turn destroys their healthcare infrastructure. They don't have the abilities to withstand these people that come into the hospitals, and they don't have ways to take care of them. They have high geographical vulnerability. They're both sitting on those tectonic plates, so they're coming in and out of contact with each other, and causing these earthquakes and these other natural disasters. And then large population dealing with poverty, exacerbating difficulties with natural disasters. Both India has one of the biggest populations in the world, and then Haiti is so big for its small land mass, and these large amounts of people coming together on these continents, on these countries, result in these healthcare issues. And then here are our references. We have 2 pages of them. Thank you guys for listening to our PowerPoint presentation.